Thank you for your statement, Cabinet Secretary. Despite recent advances in coronary care, heart disease remains one of the biggest killers in Wales. This month, around 750 people will lose their lives to cardiovascular disease. 720 will go to hospital with a heart attack, and sadly, 340 of those will die. Also this month, around 16 babies will be born with a heart defect. Therefore, Cabinet Secretary, the Heart Conditions Delivery Plan is most welcome. As the plan highlights, we are at a point where we need to deliver not a gradual, sustainable improvement, but an immediate and fundamental change in pace. The delivery plan rightly places a lot of emphasis on prevention. To reduce the number of adults who smoke, the plan states we must ensure that every contact with health and care services is used to prevent smoking uptake and encourage cessation. Despite years of highlighting the dangers of smoking, the numbers of smokers remains stubbornly high. Cabinet Secretary, what consideration have you given to the utilisation of e-cigarettes as a way of reducing the harm of tobacco smoke amongst the 19% of Welsh adults who continue to smoke? With regard to the other main lifestyle factor in heart disease, the lack of physical activity and poor diet, over half the adult population in Wales is either overweight or obese. Tackling this problem is much harder than reducing harm from smoking. So what consideration has your government given to ensuring that part of the new national curriculum focuses on teaching our young people how to eat healthily and how to live healthily? Of course, we will only prevent so much heart disease, and we therefore must ensure that we have timely and effective detection and treatment. The 95% target to treat cardiac patients within 26 weeks of referral was last met in April 2012. We welcome the progress that has been made and also the staff who work around the clock to ensure that we get the best service possible and made in reducing the number of people waiting more than 26 weeks needs to be done and done urgently. Cabinet Secretary, what are the main factors in missing the referral to treatment target? Is it down to lack of manpower or is impacted by the reduction in the number of available beds? Finally, Cabinet Secretary, the British Heart Foundation have highlighted that a large number of people in the UK are living with a faulty gene that puts them at risk of developing coronary heart disease or even sudden death. Each week, around 12 apparently healthy people under the age of 35 die from sudden cardiac death. Cabinet Secretary, what is your government doing to improve research into sudden cardiac death? And are you looking to develop appropriate population-level screening for these heart conditions? I thank you once again for your statement, and I look forward to working with you to improve cardiac care in Wales. Thank you.
Cabinet Secretary.
Thank you for the comments and questions, in particular for the welcome for the plan and again the recognition of progress that we have made and intend to make here in Wales. I'll deal with the last point first about research and screening. Of course, there's a range of research that takes place across our university and health board sectors. But whenever people mention screening, we need to take a step back and actually understand what we mean by that and what the value of all of this is. The easiest thing is to call for a national screening programme to understand and to identify early a range of conditions. But actually we need to have reliable tests that will actually tell us something useful and actually not actually undertake harm to and for people. And that is our challenge. Is there a reliable test that we can screen the population with? Do we really see health gain in trying to undertake a national screening programme in this area? Or are we going to have a greater return in terms of the value for individuals as well as the NHS with other measures? And at this point in time, I'm not aware that there is a sensible approach to population screening in this area. We need to actually undertake people where we understand there is risk and to understand the risk that people have in their own family history. On the points about waiting times, Australian waiting times reduce. As you've seen, we've, in my statement I indicated we've invested £6.6 million in the Swansea Centre as well as with more capacity to allow those waiting times to fall even further, as well as the work I've already described in answer to other questions about the work we're doing in primary care to make sure that we have alternative services, make sure the people that really do need to be referred into secondary or tertiary care have the opportunity to do so quickly. On your point about smoking falling, again, it was remiss of me not to recognise what Rhiannon Bjorn has said. Measures taken by this place on avoiding smoking in certain parts of the public estate in particular have had a real impact on changing the nature of the conversation around smoking. It's part of the armoury that we have on actually reducing rates of smoking. And it was a difficult choice to make. People may think now, of course, you shouldn't be allowed to smoke in a variety of public places, but there was very real and significant opposition at the time this place made a choice to prohibit that. We were the first part of the UK to do so. And on your point about e-cigarettes, well, e-cigarettes are not unharmful. It's not as if there's no harm at all. The challenge is we don't understand the exact nature of the harm in each of the products. That's why regulation is being taken forward and what could and should go into an e-cigarette. But I recognise some people use them in trying to give up. But we've continued to say, as a government, we're led by the evidence on what exists, both about the harm caused by e-cigarettes and them as an alternative to tobacco. So I'm not about to go off on a flyer today and announce an entirely different or new approach. We'll continue to take a precautionary approach, but we'll be led by the evidence on the right way forward. And finally, your point about diet and exercise. Again, it's come up in other questions, but there is a consistent healthy schools message, and any member who visits one of their local primary schools in particular will be hard-pressed not to see a healthy living and healthy eating message within their schools. So actually, I think our schools are delivering their part of the bargain in delivering that healthy eating, healthy living message. And the work that we're doing, for example, in rolling out the Daily Mile in schools is part of that message. The challenge always is how we engage with the parent and the carer group around that school, because they are bigger influences than our schools are themselves on the health behaviours that people acquire and then take with them into adulthood. So it's about the whole picture, not just saying it's a responsibility to schools, because actually each of us in our roles as individuals, as parents, carers, and as in our role in communities, we have some responsibility too. But the challenge always is how we help people to make choices rather than we seem to be lecturing people or telling them they're doing the wrong thing, because actually that hasn't proven to be a very effective way to deliver change. Most people understand healthy living and healthy eating messages. Our challenge is how we help them to do that more successfully and more effectively.
Thank you.